Hi, everyone, and welcome to Clinical Corner with TruCare Clinic. I'm Stephanie Guingard. I'm a pediatric nurse practitioner working in the community for about 18 years, and we're going to be talking about going back to school safely during coronavirus. I'm going to share my screen with you here so we can get started. So some goals today to define COVID, define some mythbusters that may be circulating, define how COVID affects children and challenges of returning to school during a pandemic, learning from home, and safety measures to keep your family healthy. And then at the end, we will have some time for some questions. So what is COVID-19? It's severe acute respiratory syndrome coronavirus 2. It's a new virus for humans, and as you know, it could affect the lungs mostly, but the more we learn about it, the more we can see that it affects multiple areas of the body. For short, we've been calling it COVID-19, and CO stands for Corona, VI is virus, D for disease, and 19 because it's discovered in 2019. It's a worldwide pandemic that has affected well over 3 million people in the United States. Some symptoms include fever, body aches, shortness of breath, sore throat, chills, headache, loss of taste or smell, and then widespread inflammation or no symptoms at all. This virus is spread easily through droplets for coughing, sneezing, singing, and right now there's no treatment for the vaccine, but scientists are developing treatments to help save more lives. Some people in the community might be asymptomatic. So for this reason, there have been policies that have been implemented to wear facial coverings while in public, and then also to practice social distancing, meaning being 6 feet at least apart from someone else while you're out and about. Some things that might be circulating in the community, a lot of myths. We want to try to go over those and help you gain some more understanding of those. So wearing a mask can be harmful to your health. Actually, wearing a mask is not dangerous at all. And no, you can't, it won't be hard. It might be a little difficult for you to breathe, but overall, your oxygen level will be fine. You're not going to be breathing in too much CO2. COVID can be transmitted via shoes. While it has not been proven that it can be, it's better to come into the house and kind of leave your shoes somewhere outside, but theoretically, on surface, they have found over time that coronavirus is just not spread that way as easily as breathing in and being close to individuals. COVID is caused by a bacteria that can be treated with antibiotics. So there's a difference between bacteria and viruses. Viruses have to kind of run its course. Bacteria usually you treat with antibiotics to help you get better. And coronavirus is a virus that will not be affected by antibiotics at all. If you hold your breath for more than 10 seconds and don't experience shortness of breath, it means that you are not infected with COVID. This is a myth. You may have seen some videos circulating on the internet, but it really doesn't have anything to do with your lung capacity. Now, some people who have COVID, they will complain of shortness of breath, but as stated before, some people have no symptoms at all and they still are infected with COVID. COVID can only be spread in cold environments. So as we're seeing now, it's summertime and we're still seeing an influx of illnesses. So it is a myth that it can only be spread in cold environments. Now, as we approach the fall and winter season, we're going to have flu on top of that, more cases of other viruses and strep. So we have all of those to contend with as the colder weather is going to roll around. It is okay to use UV light to kill viruses on the skin. So UV light, while it has been proven to kill viruses and bacteria on the surface, it is not safe for our skin, which is why we have ozone layer to protect and kind of filter that out. And so if you use UV light directly on the skin, it could cause damage. So we don't want to do that. You may have seen some UV light boxes that you can bring into your home to clean your cell phone and clean other things. Those are completely safe as long as you use as directed. And then lastly, children cannot get COVID. As you may have seen in the news recently that there are more and more cases of children getting COVID. as summertime and summer camp happen, you're seeing a lot more spread. So let's talk about that a little bit. Kids can get COVID at any time and at any age. We've seen a lot of infants getting COVID. We've seen a lot of older kids getting COVID. Now, while they do get it, the infection rate is pretty low. Right now, it stands at 1.7%. Symptoms for children are pretty much the same as with adults, but some may have only mild fever, some only might have diarrhea or other GI symptoms. Most children recover from the effects of COVID without any long-term effects. And while most kids have mild symptoms, a very small number might develop a more serious illness. So you may have heard in the news something called multi-system inflammatory syndrome in children. And this is something that can occur. It's very rare, but some kids have been affected where it causes inflammation of the blood vessels throughout the body. Some signs of this are persistent fever, bloodshot eyes, diarrhea, extreme fatigue, vomiting, abdominal pain, and neck pain. Signs that you need emergency care include shortness of breath, your lips might be turning blue, your child might have chest pain, severe abdominal pain, confusion, and inability to stay awake. This has been a rare occurrence, and there are more studies that are needed to understand why children get this, but understand that most children that we are seeing that have coronavirus, it really is a mild illness. Most kids have a headache, a low-grade fever, they might be really tired. So these are some signs to look for in case it gets really bad, then you want to definitely follow up with your physician. So considerations on going back to school, it's really a personal choice. I have patients who have children who might have immunocompromised illnesses, so they can't go back to school and be around other kids. Maybe they have grandparents who live with them, and so they want to be extra cautious. So it really is a personal decision. I know that there are a lot of benefits to going back to school, including social connections with other kids. You have a structured learning routine, prevention of learning loss, which we know is a big deal even when we have breaks in the summertime. I think kids lose somewhere around 15% of what they've learned the previous school year. And there's less stress on families that are unable to work from home. And then also the food security. Many kids, they really rely on school lunches to give them that meal for the day. Some challenges of going back to school are kids are in close quarters, which obviously promotes disease spread, and the influx of strep and flu during school. It's just really hard to keep them spread out. You're exposing vulnerable teachers. Remember, these teachers might have elderly parents who live with them, and also they might have other children in other schools who are their children who might have an immunosuppressed system. It's difficult to clean in between classes, hard to focus with the mask on. The kids will play around with the mask, pull it down. It's really hard. It's going to be really challenging to keep, especially the younger ones, with having a mask on. All right, and going back to school in person, it's going to be challenging, and there's really no right or wrong answer. You can see the benefits on both sides, but you want to follow the national and state local guidelines to keep your family safe if you do decide to go back to school. So hopefully these next few tips will give you some information so that you can make a good decision. You want to find some appropriate content to teach your children to prevent disease transmission. I've linked a YouTube video from Texas Children's Hospital to kind of shed some light. It makes it easier in their terms to understand why it's important to wear a mask, why it's important to wash hands. You want to practice with your children proper masking techniques at home. So it's a good idea, like maybe on the weekends or especially during the summer, just to keep the mask on for a prolonged amount of time. So that way they're starting to get used to wearing masks for several hours. Consider barriers to cover the eyes, like a face shield or goggles. If your child wears glasses, that also helps. This will prevent self-contamination, when they touch their eyes. You want to monitor your children regularly for signs and symptoms of diseases, including their temperature, and if greater than 100.4, they need to stay at home. You want to keep all of the immunizations up to date. Schools should also consider making the flu vaccine mandatory for all staff and also students. Students with high-risk medical conditions should also consider distance learning, because you have to consider if you have comorbid diseases, meaning you have another illness that possibly, if you get COVID, would make it more complicated. So those kids should really stay at home and distance learn. Now, while going back to school sounds amazing, and I know a lot of parents are really tired, learning at home has its challenges and benefits too. So let's talk about those. Students may not understand all the concepts, and students could potentially fall behind. This is a big one. This is a big concern for most educators. For children already losing a little bit in the summertime, now you have an extended, let's call it summer, where kids are really not able to get the information they need, may not be retaining it. Some students don't learn very well online, so they really need that in-person experience so they can ask questions and really understand the concepts. Some might have limited access to technology. Maybe you don't have a computer at home, or maybe you don't have Wi-Fi. And I think a lot of schools are in those areas that might have those challenges. They're doing a really good job to provide iPads and laptops. I've even seen some school districts have excuse me, a Wi-Fi van to help with that. The kids are not able to socialize with friends. Parents have to juggle working from home and coordinating home and school. So some of the benefits, there are minimal to no exposure to illness because there's more control. You can stay at home with the kids. They're just learning from home, and you don't have to really go out. You have increased time together with family, flexible learning schedules. So for some of those kids, like I have a couple who might need a break in between lessons, you have that flexibility and they can get that energy out. So hopefully can make learning more fun for them. And you have the ability to spend additional time with difficult concepts. Even though some children do better in school and they have that access to with the teachers, if there's something that's difficult, most of the teachers are making themselves available, and you have the flexibility to spend more time on those hard topics. So given all that information, and whether or not you decide to send your kid to school or stay home and distance learn, there are some things that we can all do to keep our kids safe. So you want to have your kids stay at home as much as possible. If they don't have to go to the grocery store with you, keep them home. Maintain 6 feet of physical distance. Teach your kids not to, that whole personal bubble. I know that I have a few kids that struggle with that. So you want to help them maintain that physical distance. And where physical distancing is not possible, you want to practice universal masking. Wear a mask in all indoor places. Avoid shaking hands as well as touching your eyes, nose, or mouth. And this is a hard one. There's actually been a video that was circulating early on that says that we touch our face probably over 500 times a day. And so you can see how easily it's spread because we're always touching our faces. So we really have to teach our kids, okay, cover your eyes with a shield or a goggle or your glasses, and really hand washing for at least 20 seconds, carrying a hand sanitizer. In this environment, you cannot clean too much. I know I have my kids clean as soon as they come from outside, from inside when we run an errand, or when they're playing. I mean, they're just constantly washing their hands. And I think we just have to teach our kids and ourselves a different mindset during this pandemic. It's also a good idea to have a designated area in your home for hand washing and dirty items to be placed. So maybe you come into the garage, maybe you have an area that you can designate to either leave your shoes in the garage or leave your shoes in the laundry room and hand wash and then clean all electronics before going into the main areas. As a healthcare provider, we even sometimes change our clothes and take a shower before we interact with anyone else. So just trying to keep everything clean as possible in your home, disinfecting on a regular basis is also a good idea. And then of course, we always want to make sure we're getting plenty of rest and nutrition to promote a healthy immune system. And that is it. So you can drop your questions or comments, and in a few weeks, we will get together and hopefully I can answer some more questions for you. Thank you for watching.
Hello, my name is Danielle Riddick. I am a local elementary school principal, and today we're going to be talking about guidance for parents in navigating their children's education during the COVID-19 pandemic. So this is a very uncertain situation for everyone involved. It has, it completely hit everyone unexpected. It's lasted much longer than anyone thought it was going to. So we just wanted to provide you with some steps to guide you as you're making the best decision for your student and your family for the upcoming school year. So we're going to talk about 4 steps. So the first thing we're going to talk about is taking a breath and stepping back. Then we're going to discuss all the information sources and what you need to know for the upcoming school year. We're also going to talk about some learning structures that need to be put in place for the new norm. And then lastly, we're going to be discussing just being patient with yourself, the process, and schools. So the first thing I'm going to encourage everyone to do is to literally stop and take a deep breath. There is so much information out there, and the information is constantly changing. And so this can become a very overwhelming and very frustrating situation. There's lots of research that talks about the power of the breath. When you just have deep breathing for a sustained period of time, it can help to reduce stress levels, improve your cognition, and even maybe help reduce your blood pressure. So it's really important that you do that, because before you dig into information, before you start making decisions, you want to make sure that you are in the right state of mind, that you're calm, and that you're in a place to make the decision that's best for your family. So now we're really going to dig into the information sources that are available for parents when it comes to education. In the state of Texas, we're going to be looking at 3 levels. So the first level is statewide, which is from the Texas Education Agency. Then the school districts are going to take the information from the Texas Education Agencies, and they're going to make guidance for their district. And then once the campuses receive the guidance from the school district, they're going to tell parents what everything's going to look like at that particular student's campus. So let's talk about the Texas Education Agency. They created a reopening guidance summary document, and basically it tells schools what they can and cannot do when it comes to reopening schools in the fall. So the big idea is this: schools have the option of opening with remote learning, with the caveat that they also offer in-person options to families who need that. But the other caveat to that is that there's a local agency or another governing body that gives an order closing in-person instruction for schools, then they would follow that order as well. So in general, schools can do remote learning for the first 4 to 8 weeks of school with an in-person option. However, if there's some type of order that comes out preventing in-person options, then schools will be doing completely remote learning. So it's important to know the 3 types of instruction that the Texas Education Agency has designated for the fall. So there's on-campus in-person instruction, and then there's remote instruction. And remote instruction is divided into asynchronous instruction and synchronous instruction. When you think of asynchronous instruction, think of self-paced, pre-recorded, individualized, independent activities. When you're thinking of synchronous activities, think of live, in-person, 2-way teaching that's happening between a teacher and a student. Now, also, the Texas Education Agency has put out information about required minutes by grade strand. So if you have students who are in kindergarten through 2nd grade, what the Texas Education Agency has said is that they need to participate in asynchronous, 1-way, pre-recorded, individualized activities. Now, the school districts can offer the live, in-person, 2-way teaching. However, that is not required for kindergartners through 2nd graders from TEA. However, if you have a student that is in 3rd through 12th grade, that live 2-way instruction is required every day. So 3rd graders through 5th graders will need to participate in 180 minutes of in-person live 2-way instruction every day. If you have a 6th through 12th grader, they will need to participate in live 2-way instruction every day, and that's going to be 240 minutes. And they'll also have asynchronous activities where they'll be working individually, but those 3rd through 12th graders have a minimum required amount of time they need to be engaging in live teaching. The other thing that the Texas Education Agency has put out are these public health considerations, and they outlined it in 4 steps. So providing notices, prevention, responding, and mitigation. So when it comes to providing notices, districts have to alert parents to their plan to navigate this new norm, and also they have to provide parents information about their attendance and enrollment rights. The other part of it is prevention. So things like doing screening and temperature checks. Districts have to have that in place for for staff and students when they're coming to their campus. The other part of it is response. So say that a school district or a school has a lab confirmed case of COVID-19. There needs to be a plan in place for how the district is going to communicate that from the campus level to the district level, how campuses are going to be working with their district health coordinators, and then how they're also going to be working with county health departments to determine contact tracing and how that needs to happen, determining if quarantine needs to happen, and also any notifications that need to go out to the community. And then the last part of it is mitigation. So what are campuses and school districts doing to prevent the spread of COVID? So that includes things such as social distancing, complying with mask orders that have been put in place, increased disinfection and sanitation processes, and also ensuring that there's increased hand washing in schools. Now we're going to talk about the district levels. So the Texas Education Agency has come up with mandates, and they've also come up with recommendations. So the school districts are going to take those mandates and they're going to ensure that those mandates are a part of the plan that they're creating. And they're also going to look at the recommendations that have been given, and they're going to say, okay, for our student needs, for our context, for what's happening with the spread of COVID in our area right now, how are we going to take these recommendations and put them in place for us? So it is a combination of mandates and recommendations, and that's how school districts are coming up with their plan. If you haven't noticed already, every single school district out there has some type of COVID-19 update webpage. So when you go to the homepage of your district, most likely it's going to be at the top, or it's going to be some kind of special message that says, hey, if you want COVID-19 updates, you need to click here. So make sure that you know how to access your district's homepage and how to get to the COVID-19 page, because that's going to give you the latest information for your particular district. One thing that some districts have done is created an updated instructional calendar. Because of what's going on with the pandemic, they decided to delay their start or something like that. So they've gone to their board of trustees and gotten permission to change the calendars that had been previously put in place. So make sure that you have information about the latest instructional calendar for your school district. Also, on those COVID-19 update pages, there's going to be some type of guidebook or protocols that districts have come up with to detail the plans. Now, some of them are pretty lengthy, but I would really encourage you to read through those guidebooks, because it's going to tell you exactly what it's going to look like in your district and on your campus when it comes to learning in the fall. There's also going to be some type of frequently asked questions page. So parents might say, hey, is my kid required to wear a mask? Or my student receives special education services, but they're going to be participating in remote learning. What is that going to look like? There should be some type of frequently asked questions page that's going to give you that information and answer those questions. The other thing that's going to be coming from the district is the guidelines about parent choice. So districts are putting out information of, hey, parents, you can have remote instruction, or you can do face-to-face instruction if that's an option, depending on where depending on your area. And what they're going to say is, we need to know what your child wants, you want your child to participate in, because that's going to help them make decisions. So it's important for you to know how to access that information. Like, is there a form that's coming out? Is there someone that you need to communicate with, so that you can communicate to your school to tell them, okay, my student's participating in remote learning, or my student is going to participate in face-to-face learning when that becomes an option. Something else that you want to take into consideration is, when you're making your choice about remote learning versus face-to-face learning, is there an option, like what is the option for you to change? School districts have been given the guidance that for the most part, changes need to take place at the grading cycle. So if you're saying now I want to do remote instruction, know that your student will probably be receiving remote instruction for the entire first grading period. And then when the second grading period comes, that's when you can make that change. So make sure you know what their guidelines are about that. They're going to have like change periods when you can communicate that information to them. So make sure that you have all of that. The other part that information and guidebook is going to give is about the screening processes, the cleaning protocols, mask wearing and mandates. They're also going to give information about updated grading policies, what meal service is going to look like for their district, and also special programs such as athletics or visual and performing arts. Also, if your student receives specialized services, they're going to give information about that as well. And the last piece I want to talk about for the district level is technology. So districts are really trying hard to make sure that they're creating equitable learning environments for students. And if students are in need of technology, they're figuring out a way to provide that. Now, every district has different guidelines and different protocols that they're following. So make sure that you know when it comes to technology, if your child needs technology, who you need to contact, how you would do that. They're going to have pickup and distribution time. So, and a lot of times on those forms that they're sending out to parents, they're going to have you indicate in the form whether or not you need technology. Now, when it comes to making that decision, I would think very hard about, does my child have an unshared computer that they could use 24/7? Especially if you're talking about a kiddo who's in 3rd through 12th grade, because remember, now they have to have those required minutes of live teaching. So you really want your child to have access to a computer that is solely for them. And so you need to figure out, okay, does my kid have a computer that if we don't get a device from the district will be okay? Or do we need to reach out to the district through the methods that they put in place to see if we can secure some technology? The last piece, and it's really important, is the social and emotional learning supports that your districts are putting into place. This is a very difficult situation. A lot of kiddos may not understand exactly what's happening. They may be struggling with the fact that they haven't been in school and seeing their friends and seeing their teachers for months. You know, if you have a child who's very social and likes to get out and engage with people, this can be very difficult for them. So your district should be providing you information about the social and emotional learning supports they're putting in place. School districts may also be offering counseling services. So if you are in need of that, I would definitely check out those web pages so that you can access the services you need for your student. The last level is the campus level. Now, this is where the rubber really meets the road. Right now, most of your campuses are looking at, what does our student enrollment look like? A lot of people want to know, who's my kid's teacher? You know, where are they going to be? What's going to be going on with that? But school campuses, cannot make those choices until they know, okay, this is the number of students who we have that have opted for remote learning. This is the number of students that we have that have opted for in-person, face-to-face learning. And so the quicker parents provide that information to schools, the quicker schools can make decisions about who's your child's teacher is going to be, teaching structures and things like that. Also, the campuses are going to give you information about what your remote learning schedule and what your face-to-face schedule is going to look like for your student. But remember, information is still evolving. Campuses are really still trying to adjust, so it's probably going to be a little while before there's a lot of concrete details about what that looks like. So also your your school campus is going to have those screening and protocols in place. So even though it's been mandated by the district, each campus has to decide, okay, when we're doing screenings, where do we want our kids to go? Who's going to be working with them? Who's going to be doing temperature checks? So they should be giving information about that as we get close to face-to-face opening up again. Also, what are going to be the processes for arrival, dismissal, lunch, and recess? There's a lot of things that we have to take into account as campuses that we didn't have to previously, like keeping the number of children in one area down, making sure that students are able to socially distance in the space that they're in. So all of those decisions are being made right now. Also, the campus, in conjunction with the district, as I previously mentioned, will give you information about, if we have a COVID-19 confirmed case, this is how we're going to handle it. This is the steps that we're going to take. And the last piece, really, with your campus is communication. Look at their website, look at their social media pages. You know, if you need to send them an email, do that. Really spend some time getting the information that you need for your kid. Also, I know some school districts are doing informational sessions or town hall meetings where they're letting parents know what's going on. So find out about that so that you can get everything that's going on with this situation. All right, so I think we really dug into what our information sources are and the 3 different levels. Now I want to talk about structures for learning. So you really have to ask yourself, what is learning going to look like for my student in the fall? One thing that people may not realize is that schools are extremely structured. I mean, we have a schedule for everything, and kids are used to that. They're used to, okay, at this time I'm with this teacher, and this is what we do, and we go to this place, and we stand at this line, So kids are used to all that structure and all that routine. When we closed in the fall, they really lost that. They lost the structure of school, and so it's important that we look at the scheduling and routines that we're putting in place for our kids to give them that structure, and then also we really need to adjust to our new norm. When everything closed in the spring, I think there was a lot of, thinking, oh, we'll be closed for a month and then we'll be able to be back in school. And that clearly hasn't happened, just, because of everything that's going on. So really getting our kids adjusted to, for this point of time, we're going to be doing learning in this way, and this is what it looks like for us to do it well. So depending on the option that you've chosen for your student, that's going to determine the types of structures that you need to put in place. So right now, for the most part, everyone is doing remote learning. And once again, check with your district and figure out what's going on with them, depending on the county that they're in, the orders that have been put in place. So with remote learning, it's really important to have a designated learning space. So it could be a desk and a chair. If your kiddo's got some jitters and they need to bounce on a ball, that's perfectly fine too. But there needs to be a space where your kid goes and they know, okay, when I'm here, I'm focused, I'm tuned in, I'm ready to learn. It really gets them in the right mindset to do learning. The other important piece is a schedule. So giving them some structure, giving them routines. And then also, if your child is doing live two-way instruction because they're in 3rd through 12th grade, the schools will be providing the schedules and the times of when those sessions are happening. Another huge part of this is school districts are adopting learning management systems, because we need to be in the place that if at any point we need to be in remote learning, we can do that. And so make sure you understand what the learning management system is for your district, and you have access to the technology, the bandwidth, all of those things that you need to access it well. Also find out if there's how-to sessions, if there's informational videos, how you get logged in, everything to make sure that when school rolls around, you guys are ready to go. And I would say, whether you're doing face-to-face or remote learning, you want to look at the social emotional support you're providing for your students. So like I said previously, districts are going to put those things in place, and they're going to have options available for parents, but it's important to make sure that you're really spending time helping your students grow in their emotional regulation, helping them know how to process their feelings about everything that's going on. So finding some resources to be intentional about that time with your student every single day. Now, face-to-face instruction, when that becomes an option again, depending on where you are, you have to help your students understand that when they go back to school, it is going to be different from what they're used to. Kiddos are used to, coming in, giving hugs, and everyone's really close together. And in this new season, in this new norm, that is not going to look the same. So kids, when they come, they're going to be screened. They're going to have someone checking their temperature possibly. They're going to have masks on their face. They're going to be socially distancing. They're not going to sit next to each other at lunch. So everything is going to be a lot different than what they're used to. And, and that can be very difficult for them. So really spend some time, once you have that information about what your campus process looks like, spend some time with your kiddo to help them understand, okay, sweetheart, when you go to school, someone's going to, they're going to ask you some questions, or they're going to take your temperature, and make sure you keep your mask on your face. And it's really important that you're washing your hands, like just reminding them of all the things that they need to do so that when they get into the school setting, they're not surprised. They're not as afraid, because they understand this is just what we have to do right now to keep everybody safe. And the same thing, you're going to want to make sure that you have access to that digital learning system or that learning management system, because a lot of instruction and information is probably going to be coming through there. And the most important piece, whether you are doing face-to-face or whether you're doing remote learning, is to have your support system in place. Who are those people that you can call to say, hey, I don't understand this. Can you help me out? Who are those people who can really help guide you through this in those moments where you may feel stuck or frustrated? The last piece of this is really just being patient. Be patient with yourself, be patient with your kids, be patient with the schools and the district, be patient with the process. This is an ever-changing situation. We're really uncertain of what the future looks like, what our next step looks like. So it's really just going to take some time to say, you know what? Things didn't go perfect yesterday in our lesson. That's okay. We're going to try again tomorrow. And, and like I said, rely on those support systems that can help you to grow every day as you're supporting your child's education. And also be patient with the schools and the districts. This is something that we've never experienced before. So we're really trying very, very hard to make the best decisions for our students and their families. So as I said, when you're making decisions for your kids this fall, please stop, take a breath so that you can get yourself in the right headspace, really know what your information sources are and make sure you're checking them often because that information is constantly updated. Put in some structures for learning for your new norm. And lastly, just be patient with yourself, the process, and our school. So thank you so much for joining us for the Clinical Corner with the TruCare Clinic, and we look forward to meeting you live at an upcoming live webinar session. So if you'll click the link, you can receive more information. Thank you so much and have a blessed day.